So biopsychosocial, so the biology, right? So we talked about the biology, we talked about dopamine. Remember, there's a couple other major neurotransmitters, at least you should be somewhat familiar with. Some of you probably, or most of you have heard of serotonin, right? SSRI. So what an SSRI is, it is a selective serotonin reuptake inhibitor. It selectively inhibits the reuptake of serotonin. So how two neurons, right, they communicate with these neurotransmitters, right? How the brain how the brain essentially neutralizes those transmitters is it takes some of them back up into the body of the cell. So reuptake, right? So cocaine is a dopamine reuptake inhibitor. It inhibits the reuptake of dopamine. So there's more dopamine in that synapse, we call it, in that space between the two cells, right? So selective serotonin reuptake inhibitors increase serotonin in the brain. What they found is, oh, this is interesting. You know, the population that had increased serotonin levels were less depressed. Okay, so we'll call it an antidepressant, right? So that's kind of the philosophy in it. Now keep in mind, there is surely a growing population in the science community that says, well, how effective are they really for mild to moderate depression? Because remember, placebo, which is just amazing to me, if you think of the placebo effect, right, 40% of the group gets better on sugar pills. How does that work? How does that exactly work? It's really hard to understand. But it's the mind-body, right, communicating. It's because they believe it. That's really the bottom line, because they believe it. Now, if you have a 40% placebo response and a 48% drug response, the FDA says, hey, listen, it's better than placebo, approved. But really, 8% greater efficacy, yeah, you know, some people are starting to now question that. Well, how much better is it really? Now, surely, I have some patients, and I'll tell you, they've dug knives into their arms, serious attempts, hanging. I'm not real quick to wonder, you know, let's take you off your antidepressant. No, I'm going to be very careful. Again, risk versus benefit. If I know that, listen, they've ended up in the hospital, they've had 3 suicide attempts, I'm not going to take them off their antidepressant, right? So there seems to be some feeling that on the more severe ends that it actually is more effective. But in the mild to moderate, are we really just seeing a placebo response? That's a kind of a question in the psychiatric world. But I have a lot of colleagues that would disagree with me, you know, in the sense of, no, this is how it works. But I'll tell you, you go look this up. You go look up certain these medications, how do they work, mechanism, and you'll go, it says mechanism unknown. I'm like, what? Mechanism unknown? Like, as if I'm a scientist by heart, you know? I'm like, how can this get FDA approved, mechanism unknown? So you have to be careful, right? Also, you may see SNRI, that's serotonin and norepinephrine. That's a third neurotransmitter. So we've talked about dopamine, we've talked about serotonin and norepinephrine. And there's actually a whole host of other neurotransmitters, but those are the big ones you need to worry about.